Hi, I'd like to talk about children in chiropractic. There are a lot of adults, parents out there who want to know why my child should be adjusted. So we're here today with Dr. Ralph Andrade. Did I get it right this time?
Yeah.
Okay, yeah, I'm not good at words. What can I say? So children in chiropractic, I was that way. Why should my child be adjusted? Why is it so important, especially for, say, firstborn? The child's just born.
Kelly, just think about the birthing process. I mean, it's just
Wow.
coming into this world, okay?
Okay.
Whether C-section, not C-section, and we know C-sections are on the rise, right?
Yes, they are.
Or it's a smooth birth, or everything went, it's a process.
Mm-hmm.
I mean, so the babies, in my mind, should be checked. There's very few that, and it's very simple. If you have a spine, at least be checked.
Okay. Well, I mean, let's say 100 years ago. I mean, 100, 200 years ago, they just said child's born, it's not traumatic, or is it the way society's become? Or are we just learning that it's more important? I think that's what we see now. It's
Correct.
more important, okay. So children in chiropractic, how is it with, disease and everything? Is that going to be beneficial for the children?
Well, we know that getting adjusted under chiropractic care, your immune system is better.
Oh, definitely.
Okay?
Definitely
So
agree with that.
it really doesn't matter what the child is experiencing, what symptoms they're having. Getting them adjusted, it will allow their body to function better, the immune system to function better, to allow them to get through this little healing crisis.
Be prepared, actually.
Correct.
For anything that might come. Because most people think you have an accident, that's what happens. That's how I got introduced to it. I'd be the first to tell you that I had an accident, I need to be adjusted. But now we're thinking it's more positive to be, thinking of his lifestyle.
Correct.
Great. What about vaccinations in children? I know chiropractic lifestyle talks about that.
I tell my patients, I tell parents say, look you need to get the information. Just because someone in a white coat is telling you, oh, this is okay, look at it. I always, first question, if I have somebody who's, wants to, what is the safe level of mercury for a newborn baby?
Yeah.
What is it?
Yeah.
If you could find that, I'd like to see it. It's never been done. So mercury is like the second most deadliest compound element on the planet.
Yeah, but see, when your child's born, my child was born, and they say you have to have these vaccinations before you leave the hospital. What can I do? I know some states now, we didn't know then, you can opt out, I guess.
Correct.
Okay. Is it getting easier? Or is it being more acceptable, I hope?
They may try to say, oh, you can't, but if the parent is informed, then you can make an informed decision, not based on what my chiropractor said or what my neighbor said, but because mom and dad know.
Right. Well, that's important.
Correct.
It's being educated on what's out there,
Right.
especially vaccinations. Because I have a friend, someone I know, whose child got vaccinated years later and then started regressing into autism, as a matter of fact, which is very important. How do you look at autism?
All the studies, all the stuff I read, there's not been one person that has autism that was not vaccinated.
Really?
If 2% of the population don't vaccinate, it's only 2%, then it would think that if it was not something in there, that maybe 2% of autistic children would not have been vaccinated.
Wow.
So, it's just, find me one.
That's a good point. And we're looking into that as well because of our friend.
Correct.
And I'm always sending her information, what I find. And she's been working with chelation.
Correct.
Which is healthy, trying to get all those things out of their body, and of course organic and healthy food, and he's doing much better now.
Fantastic.
Great, yeah. My son had ear infections.
Okay.
Okay, so we're talking about all these childhood diseases, things that come up: ADHD, autism, ear infections, cold, flu, fever, everything.
Right.
So we need to look at it from a different angle. How is that?
One of the things that I try and do in my practice is I want to get mom. And typically, mom's the one that makes all the decisions anyway, right? Not the dad.
Not always.
Mom's the one that gets up in the middle of the night when the kid's crying because they want it. Typically.
I did it wrong.
Right. I have to give mom a choice, another choice.
Good.
Not just reach for the Tylenol or to do something that, you know, we have to give them an option to realize, look it, they have a fever, it's okay, okay? My kids, obviously, we talked before, I'm the chiropractor, so I can adjust them in the middle of the night. We can do I have 3 kids that, you know, chiropractic kids. I've had, you know, warm showers at 3 in the morning because of 104 temp. We've done that, the ice chips. But once we can let mom know, look, they'll get through this, they'll be okay.
That's actually your body.
Correct.
Working. Okay. What about ADHD? That's a big thing now. You keep hearing it. I personally think, okay, correct me if I'm wrong, I think it's some parents just not wanting to deal with their children and teaching them. And not always, but I think some are using it as an excuse. It's a quick cure for their child being overactive.
And typically what happens is it's usually brought up in school.
Yes.
So let's say little Johnny won't sit still in school. Well, maybe little Johnny doesn't learn the way the teacher is teaching. Maybe he's more tactile. Maybe he can't sit in his chair and have it, you know, just spoken to him.
Wow.
Or maybe he needs to see it. How does that child learn? If you don't incorporate the 3 ways of learning, then little Johnny's bored. So the latest research I read, 40% of kindergarten boys are on Ritalin because they won't sit still.
That's what they.
It's crazy.
They said the same thing for my son, and I said, no. Oh, it was a relative. Well, he seems a little active. Maybe you should get him checked for ADHD. And I went, no, he's a boy, and he has to learn, and he's never had a problem.
Correct.
But the first thing they thought of, oh, he has ADHD.
Well, that's real easy to throw that
Sure.
out there. So
Exactly.
again, let's give mom an option.
Choice.
You know what? If that little boy's jumping around, what'd they have for breakfast? Is that sugar-laced cereal? You know, maybe. So let's clean up. Let's look at the nutrition. Let's go back to the kitchen. Let's see what this kid's eating.
Right.
What he's putting into his body that he may be reacting. I mean, I've seen kids. You know, they have they have a little bit of sugar and now they're bouncing off the walls.
And each child's different. You know,
Right.
It does affect them differently. My son was that way when he was little. Not as much anymore.
Perfect.
Of course, he doesn't have as much sugar anymore. We're back to the chiropractic lifestyle.
There you go.
So he did have ear infections.
Okay.
And I was a bit concerned about that when he was younger. I was lucky with the pediatrician we had. He was open to choices.
Okay.
Okay. But most of the time with ear infections, what do they do?
Well, they're gonna recommend an antibiotic, which, I mean, they want to give an antibiotic for
everything.
Everything.
Pretty much.
I tell moms, look, maybe you can do a garlic capsule in the ears. There's some choices you can do.
Garlic capsule. I
Garlic
didn't know
is
about
a
that
natural
one.
antibiotic.
Right. I've
all
learned that on here.
Right. So if you can put a couple drops in the ear, and obviously get adjusted so we can remove any neurological blockage, get that lymphatic system going.
Right.
Work with the body system to clear out. The child will go through it. They may be a little uncomfortable, but when they get on the other side, they're stronger for it, and they're gonna get better.
Great. A lot of answers. I mean, I think there's better alternatives for us, for our children, instead of giving them antibiotics. That's the worst thing in the world, to always give them antibiotics. I got lucky with my pediatrician. They put pain drops in his ears so at least we could sleep and he could get some rest.
Correct.
And that's good.
Beautiful.
I think it's great. I love this. All parents need to listen to this. There's an alternative to going straight to a doctor and getting antibiotics or anything else. There just is. There's an alternative. And you are a great choice to go to help us out with our children. I appreciate it, Dr. Ralph. That's where we're going to go. There's a choice out there, parents. Let's go to it. It's a lot healthier.